When I got cancer at age 9 and had my leg amputated, one of the very first questions that I asked was, will I still be able to go skiing? It's been an important part of my life, and it's all an important part of who I am. I've been to 6 Paralympic Games in the past. I've won a total of 11 medals, including 6 gold. So the initial catalyst to come to Winter Park was a qualifying race, and I qualified in all 5 events for the Paralympic Games, and just coming back to the end of the base area, training and basically finished for the day. I was just cruising down. I wasn't skiing hard or particularly fast or anything. Hit a little slick spot on the snow, fell onto my left hip, and unfortunately fractured the femur. I actually waited 24 hours until I went presented at Denver Health Medical Clinic in Winter Park. Pain just wasn't improving. I could deal with it, but I probably didn't sleep much. I couldn't stay still very much. And then the morning after, I walked into Denver Health Medical Clinic.
Here at Denver Health Winter Park Medical Center, if you sustained an injury, say a leg fracture up on the hill, and you were brought down to our medical center, you would receive x-rays, pain medication and management, as well as a full assessment of any other injury you might have. If that leg injury then required a higher level of care, we would consult with the orthopedic surgery down at Denver Health main campus.
We definitely have a lot of very acute orthopedic injuries that need to be treated next day or same day. And so those are the ones that we send in an ambulance, and Denver Health Orthopedic Center takes care of them.
And I can say it is the best care that you can receive in terms of trauma services within the state of Colorado. From the time you're having an injury on the ski hill with our Winter Park Ski Patrol into Denver Health Winter Park Medical Center and then down to Denver Health, you're going to just receive excellent care.
And in addition to that, they do a really good job of reaching out to people. And so we usually will be able to have the patient get a phone call from one of our surgeons same day or next day to talk about the plan of care. And it's been going really well. And I feel like that continuity of care has been really great.
Been pretty quick and happening since then. A consult yesterday afternoon, and this morning I'm in surgery. My medical team here have been great, meeting them, seeing their professionalism, answering my questions, being able to show a little flexibility around my requirements of wanting to compete in Italy.
Michael Milton is an incredible individual. We want to try to get him taken care of so that we can get him to the Paralympics. Michael has an injury to his femoral neck. He has a fracture that is completed all the way through, but it is non-displaced. And so our goal is to get the patients back on the slopes as quick as possible. The outcome of today's surgery, I anticipate, will be a successful one. I'm optimistic that we're going to help improve Michael's pain and get him mobilized much faster and back to some of the activities that he really wants to be doing.
Between knee crash and surgery, and I'm pretty mobile and generally okay, so it'll definitely be a rushed recovery, but I'm hopeful that we can make it work.
Michael has faced some incredible challenges throughout his entire life, and he's an incredibly passionate and motivated person, and when he sets his mind to something, not only does he achieve it, but he surpasses any of the expectations that were set before then.